Hi, everyone. Thank you so much for joining us today. My name is Taylor. I work in marketing at Sanova Dermatology, and I am beyond excited because we are talking about our newest neuromodulator today with a neuromodulator queen, Dr. Kristy Charles, who practices at our Metairie and Old Metairie locations in Louisiana. Hi, Dr. Charles.
Hi, how you doing?
Good. How are you?
Good.
Good. Thank you so much for joining us today. I am so excited to talk about this. We've had an event recently kind of discussing this exciting product, but people just keep talking about it. So we have to keep talking about it. So to start us off, can you explain to me what is Daxxify?
So Daxxify is the newest neuromodulator that we have. It is similar to Botox, Dysport, Juvo, but it's made in a different way that is allowing the product to last longer in the treatment. So we'll go into more detail about kind of like how it's formulated and why it works that well. But the key thing is that it's a new neuromodulator, so like a Botox,
Mhm.
but its duration is longer.
Well, I mean, that's music to my ears. I love that. I
Mm-hmm.
love to hear it. So just to reel it back a little bit, we're going to say in general for neuromodulators, can you explain to me what a neuromodulator is?
So a neuromodulator is essentially like a medication that we can put directly into the skin that works on the muscles to help decrease movement that we don't want, that's creating fine lines and wrinkles. It works directly on the nerve synapse, and essentially the product helps decrease the accumulation of like a product that's going to affect lines in the face.
Okay.
Probably more science than you needed to know, but that's kind of the breakdown.
Hey,
And
we
I can
love it. We
explain how
love it.
Daxxify is a little bit different.
Yeah, for sure. That is a great explanation. It kind of helps us. Explain who would be a great candidate for a treatment like that.
So, in general, any of these neuromodulators can be used for anybody who's starting to see lines at rest or who have lines at rest. So, those are good candidates. Daxxify is really great for people who really only want to come in twice a year. So, if you're busy and you can't get in here every 3 months, every 4 months, which is the typical duration of Botox and Dysport, Daxxify allows you to come twice a year. And that actually helps decrease the amount of time you have to come to the doctor's office, making your treatments last longer, making it less of an inconvenience.
I love to hear that. I love that there's a different option. I feel like it definitely sounds to me that Daxxify is as we said something that's kind of offering a longer lasting treatment for those wrinkles, minimizing the muscle movement to create those creases and all of that fun stuff. But it's great that someone who probably is a little bit less inclined to visit frequently would be able to benefit from something like that. That's great. So can you explain to us kind of what the difference is in the longevity of your standard neuromodulator and what they're kind of saying is the current duration of a Daxxify treatment?
So, Daxxify is supposed to last anywhere from like 4 to 9 months. In general, I've kind of been leaning more towards 4 to 6 months because I don't think tons of people get the 9 month longevity out of it. Definitely some people do, but I think more common, our goal is around 6 months, where Botox and Dysport, Juvo, other products are more a 3 to 4 month duration,
Okay,
which is why they require about 3 visits a year as opposed to Daxxify requiring two.
that's fantastic. So for the results that you're seeing so far, are you feeling they're comparable to other products? Are you feeling like you like the results that you're seeing with Daxxify?
I do like the results. I feel like in general, patients feel as they're getting the treatments in the office that it feels the same as Botox and Dysport. So as far as the injections, how many we do, the actual procedure feels the same. Daxxify can kick in a little bit quicker. Some of my patients notice Dysport kicks in quicker than Botox. So this is closer to Dysport in that it's going to kick in very quickly, which is nice. So kind of adding again to the longevity because you're getting it on the front end too.
I love to hear it. And the first thing that comes to mind for me is like, I know when people are looking at going and having a big event, sometimes you're getting down to the wire and you think, oh my gosh, like I need to go do something. And a lot of things that involve cosmetics take a little bit of time to enact. But I mean, I've heard that results from Daxxify can begin to show even as early as like 24, 48 hours after being injected.
Yes. And that's correct.
Extremely exciting, something that's definitely new. Whereas I think with your standard treatment, I believe that things start to show within a couple of weeks, right?
Yeah, Botox, you'll start to see that change at about 7 days, but really that full effect at 14 days. Dysport is more like 3 to 5 days that you start to see it. It is a little bit quicker than Botox for most people. Everybody is different, so not everybody gets that, but in general, this is we're starting to see results a little bit before Dysport, which is cool.
I love that. Well, what it sounds like is we're juggling all these names out here, and sorry if it's confusing. We know the vernacular and we love to talk it, and it makes us excited. But the important thing is, and I will always say this, and I say this every time that I chat with you guys, it is super important to be evaluated and have a consultation with a provider, especially our expertly trained providers at Sanova Dermatology, like Dr. Kristy Charles, to figure out what the best treatment plan is for you. You may have deeper creases or more defined lines that maybe partnering another procedure with a neuromodulator would help benefit you more. So you may be seeing longer lasting results with Daxxify for continuing those fine lines, but maybe adding another procedure in would be helpful. And on that note, what treatments do you think partner well with a neuromodulator like Daxxify?
So things that we could do to complement Daxxify are procedures like microneedling and Fraxel. So those are two different devices that both stimulate collagen production in the skin. So the neuromodulator like Daxxify is going to help decrease fine lines and wrinkles by decreasing the movement of the skin. But sometimes by the time we actually make it to the office, we might already have lines at rest that aren't just with movement. So Daxxify can help soften those lines and can help decrease them from getting deeper. But the procedures like microneedling and Fraxel can help stimulate your own body's collagen production to help refill those lines in a natural way as well.
I love that. It's very well-rounded, and this is why you have to go see them, see the doctors, see the dermatologists, see those specialists, because they know exactly how to get you looking your best and feeling confident. Can you tell me really quick, this is, I think, a very important question, especially for those who may not be super familiar with injectables. Can you tell me, often people will partner neuromodulators with a dermal filler. Can you tell me where someone would get treated with a neuromodulator?
So a very common area would be between the eyebrows, called the glabella. A lot of people get the 11s or a single line. And those are really bothersome because they make people look tired. It makes them look angry. So that's probably like our number one area to treat. Other areas that are common are forehead lines, the smile lines around the eyes. More common, trendier things are the lip flip, where people get a couple units of the lip. Younger patients usually just get a little flip, which is a nice way to kind of have fuller lips. But most commonly between the eyebrows, forehead, and around the eyes.
That's fantastic. So yeah, basically anywhere that you would see movement when you smile or when you're talking.
Exactly.
And something that I think people, before we start talking about dermal fillers, I gotta connect the dots here. We're rolling. These results, do you feel like when you're treating patients that their faces look completely frozen and they can't show any expression? Or do you feel like it's just a softening? Give me your spiel.
So that is complete provider dependent. So if you're going to a board certified dermatologist who is knowledgeable about the product and knows how to inject it, we don't like our patients to look frozen. We want a very natural result. We don't want anybody to know you got anything done. They just want to figure out what you're doing because you look so good. So done, and everyone's different. Everyone's going to require different amounts of units in their foreheads and their glabella and their crow's. And we have to evaluate the skin and kind of figure out what your units are so that you still have some movement, but it's less, and you look younger and fresher and less tired without it looking like you had any procedure done. And if ever myself or my colleagues at Sanova are not sure how many units, we always do less because we can always add more in. So if you're just starting and you're like, well, I don't want to look frozen, we can do like small doses to kind of get you used to it, and we can put more in if you want more of an effect, but we can take it very slow.
I love that. That makes me feel super comfortable with the idea of doing it. I mean, I know that when I go in, I'm like, freeze me, get me. But
Some people like to be frozen.
We have a large canvas here, so we have to let.
Yeah.
But anyways, I love hearing that. So back to the conversation we were having. So neuromodulators, more forehead, in between the eyebrows, crow's feet, maybe some other special areas that you can talk about when you come in for your consultation. But tell me more about dermal fillers and kind of how that differs from a neuromodulator.
So dermal fillers are used for volume loss.
Okay.
So areas like the nasolabial folds, the marionettes, which is when people start to kind of have that turned down lip. You can augment the lip or the chin. You can do the lips as well, jawline, mid-face. So all that area where as we age, we lose bone and collagen and our face starts to kind of sag a little bit. Fillers help pick it up. And done appropriately, you should not look too filled up. It should be a very slow, gradual process to make you just a little bit less of, like a good thing to do would be, if you look at pictures of a young face versus an older face, the light will hit a person's face on their cheekbones. When you get older, it starts like kind of hitting down here. So our goal is to kind of pick things up so that the light shines where it should, which is right on the cheekbones. And that's something that we can talk about in consultation. It's kind of a way to make it natural without ever knowing you had fillers done.
I love that. Yeah, it just sounds like all of these things really partner well, depending on what your concern is, to really offer a full rejuvenation. And what's great about a lot of these things is the longevity of them, especially with maybe just doing maintenance treatments or whatnot. There's just a lot of really great opportunity when you have your consultation, kind of have that great conversation to discuss what your options are. And then we kind of talked about this already, but for Daxxify specifically, what makes Daxxify a great option for some people in regards to results, time it kicks in, all that kind of stuff?
So I always really feel like it's a matter of preference, right? So if there's a person who just really wants to try something new, they just want to switch it up, Daxxify is a great option. It's a new neuromodulator. You might be somebody who gets 9 months out of it. So that's kind of like really awesome if that's the case. It's good for somebody who works Monday through Friday, and it's really hard to get time off, and they can only come to the office every 6 months, but they want their skin to look great for more than just those 3 months that you're getting out of Botox or Dysport. Daxxify is like the option for them. I think that's mainly, I think those are the two main things I would think about.
Well, those are very important things. So small risks, but great benefits. I love that so much. So we talked a little bit about the average duration is anywhere between 4 to 9 months, which is a really great opportunity. It's obviously going to differ per patient, so you kind of have to set expectations, but I think that's the way that it is with everyone. It's kind of a generalized explanation of when it should kick in, how long that it should last. I think it sounds like we've really talked about the majority of the things. Oh, one other thing I have, very important. So when discussing the longevity, like we were just saying, the duration kind of resembles around double of what a treatment with your average neuromodulator is. I guess this is more of a statement than a question. But what's exciting is that the price is not double. So I think a lot of people will have questions about pricing, which always a fun conversation to have, and that's definitely something to talk about when you're in the office. But I did want to reiterate that although the technology allows for the results to last longer, some would say double, that it's not going to be double the price. So it's not going to be aggressive. It's going to cost more than your average neuromodulator treatment, just to set expectations. But it is not double, which is really exciting. So you really are getting larger benefits with this procedure. But thank you so much, Dr. Charles. Before we go, did you have anything else that you wanted to add? Anything?
No, just to piggyback on what you said about pricing. per treatment, you're going to pay more.
Yeah.
But if you're getting that same treatment twice a year as opposed to something 3 times a year, we're finding that it might actually save patients money. So it's all kind of dependent on the patient, but it's kind of a weird thought. You pay more at that visit, but you're only paying it twice a year as opposed to paying slightly less and paying it 3 times a year. We're kind of realizing that Daxxify might even be more convenient and in the long run, less expensive per year.
Gotcha.
So again, dependent on the patient and what they need, but it's a nice thought to think of it like that.
I love that. I mean, any opportunity to save is a really great option. So anyways, not to get in the weeds about money, because that's something that you got to talk about when you're in the office. We do have regular promotions that we have throughout the year to save on these types of things, but we generally just are you know what I mean? Everything is relative. So it just depends on what your goals are and what you're hoping to achieve. But we do have a special offer for you guys. There is a special introductory pricing that we're offering only through the end of this month. So now is the time. If you're interested in trying this new product, Daxxify, it is the time to try it out. So we will be sending you guys more information. Call your preferred location to schedule your consultation or your appointment. And we are really excited for you to try out this product. We know that you're going to love it because we do. Thank you so much, Dr. Charles. We appreciate your time today.
You're very welcome.
We're visiting the Old Metairie office at Sanova Dermatology today to try Daxxify, which is an alternative to Botox and Dysport. Today we are seeing Dr. Kristy Charles, and I'm making these silly faces because they're taking my pictures. We want to see where my frown lines and my smile lines are so we know exactly where we want to place the Daxxify. Next up, I head to the treatment room, and Dr. Charles actually laid out where she wants to place each syringe specifically for my face and how many units in which spots. And you can see that they're all drawn up here, and they actually write it on the paper as well. The first step is her marking my face exactly where she intends to place each syringe. If you've never done this type of treatment before, don't be afraid of it. The syringes are very small, and they take their time and explain it to you, tell you when they're about to do the procedure, and it's actually like a pinch on your face. The difference between Daxxify and the other products is that this one is intended to last on average about 6 months, and it's unique in its formulation. It uses a different peptide as a stabilizer that does not contain any human or animal byproducts. The units translate differently than Botox and Dysport, and your doctor can customize these and manage a plan that's perfect for you. Dr. Charles was wonderful, and I cannot wait to see the results.